My community collaboration project is about developing and engaging an external advisory committee to help plan our 2021 Community Health Needs Assessment for Cook Children's Healthcare System. So, a little bit of background information about this project. Cook Children's operates as a nonprofit hospital, and it's a requirement of the IRS that nonprofit hospitals must conduct a community health needs assessment every 3 years and create an implementation strategy plan for addressing the discovered needs. Then the hospital must report annually on how they are addressing those needs during that 3 year cycle. And my role at the Center for Children's Health within Cook Children's oversees this assessment process and evaluates the programs that address the needs identified through our needs assessment. Our 2021 assessment will be our fifth triennial needs assessment cycle, and for this time around, we'd like to create and engage an external advisory committee of community partners to weigh in and help guide our assessment efforts. And so throughout the discovery process for this particular project, I learned that we not only want to engage community stakeholders in the planning of our 2021 Community Health Needs Assessment by developing an external advisory committee, but what we will also be able to do is collect specific feedback from these members on behalf of the community professionals' perspective for our needs assessment through key informant interviews. We want to strengthen community partnerships with representatives from local higher education and academic institutions on this committee, and then use this process to identify new community partnerships in Collin and Grayson counties, which are two new counties that we're incorporating within this next needs assessment. And then finally, we also want to engage members of this external advisory committee to help disseminate and share the results of our needs assessment within their own communities. So the scope of this collaborative involves developing an external advisory committee, but more specifically, committee members must involve representatives from specific IRS categories, such as advocacy and social services, the business and faith-based communities, medical public health providers, K through 12 school administrators, and higher education institution representatives. The needs assessment must assess the primary service region of Cook Children's Hospital, which includes the counties of Denton, Hood, Johnson, Parker, Tarrant, and Wise, and then our two new counties of Collin and Grayson. So our committee should also include at least one member from each of these 8 counties. We hope to hold at least 6 virtual meetings this next fiscal year, and the feedback we collect from our partners and members of this committee will help guide our CHNA methodology and planning efforts. And so the stakeholders of this external advisory committee and our community health needs assessment as a whole really are individuals within our community that work with children and families in some capacity, specifically from these categories listed on the slide that you see in front of you. To increase community stakeholder engagement in our 2021 Community Health Needs Assessment, our vision includes developing an advisory committee with representation of at least one member from each of the 8 counties in our primary service area. We want to use this committee opportunity to strengthen community partnerships with representatives from a higher education institution specifically to investigate internships or project opportunities within the Center for Children's Health beyond our CHNA process. So we'd really like to engage at least 2 higher education institutions. And then we want to hold 6 to 8 advisory committee meetings throughout the 18-month planning, data collection, and analysis process. Historically, our community health needs assessment includes a household survey of about 8,000 parent respondents, along with a community leader survey and publicly available secondary data to assess the prevalence of certain health conditions. But with our 2021 assessment, we'd also like to include qualitative data collection through virtual parent focus groups and key community leader interviews to really assess the why behind health inequities and the social determinants of health. Our external advisory committee and partners will be able to help us recruit families for these virtual focus groups. All right, so for getting organized, we have recruited members for this external advisory committee through email and also included a formal invitation letter signed by our CEO. We've scheduled virtual meetings in November, January, March, and May. Our first meeting is November 20th, and we'll meet via Zoom. We will communicate with our members in between meetings via email, and then we'll plan meetings in advance to include group discussion questions and polls for soliciting feedback from our members. We will also allow time for breakout rooms and small group discussion for deeper conversations, and then also encourage participation in the chat feature for those that feel more comfortable providing feedback that way instead of speaking in front of the group. Some of the metrics we've achieved thus far with this project have been that we've created our committee and we currently have 21 active members. We set out to include representation from at least 2 higher education institutions, and we currently have a professor from the School of Social Work from both Texas Christian University in Fort Worth and the University of Texas at Arlington. We currently have 4 meetings scheduled on the calendar. In progress, we hope to have at least 75% attendance from members at each meeting. We'd like to hold at least 6 meetings over an 18-month period. We will strive for active participation from each member present at our meetings, whether that is verbally or in breakout rooms or in the chat feature. And then finally, we will work to collect feedback from 100% of our committee members, whether that is at the meetings, through phone conversations, or through email. This community collaboration project has really allowed me the opportunity to strengthen our community health needs assessment this next time around, and I'm really excited to see where this committee and the partnerships that we develop through this committee will eventually lead us. Thank you.